Good communication skills are vital for everybody in the health professions, whether you're working with patients or maybe you have a position that's a little bit more behind the scenes. My main advice would be to know your audience. If you're talking with patients, we need to be able to ask questions that are appropriate to those patients and to be able to get information from them and to be able to give advice that they can follow and apply in their everyday life. It's very important to be able to communicate accurately with other health professionals. For example, if you're handing on patient case notes to another health professional in a hospital setting, or perhaps writing up a report about a patient in a community setting. You also need to know the audience. For example, if you're in an academic field such as myself, we need to know who's reading our paper and structure the writing appropriately to that type of audience. I think being concise is very important. It's also important to, I guess, not fall into the trap of writing too colloquially if we're talking about scientific writing. In terms of the verbal communication side of things, it's important to be able to understand the patient's language. For example, a doctor or a pharmacist hearing about a patient who has a crook knee, or they've had the runs, or a pain in the gut, or a frog in the throat perhaps, a bung eye, a dicky ticker, those sorts of things. There's a lot of Australian colloquialisms and lingo that really need to be understood by the health professional. So being able to understand the patient's language and be able to, I guess, use that back with the patient is very important. So that's really one of the techniques. We kind of refer to it as being bilingual, speaking the patient's language, but also being very fluent in health professionals' language. So good communication skills really are relevant to everybody studying health sciences.